Good afternoon. My group is conformed by Kevin, Diego, and Luisa. Our chosen item is called The Effect of Topical Olive Oil on the Healing of Food Ulcer in Patients with Type 2 Diabetes, a double-blind randomized clinical trial study in Iran. Diabetes foot ulcer is one of the most common and devastating complications of diabetes mellitus, which has indicated as increased during their lifetime syndrome in the past decades. Recent investigations have shown that more than 15% of patients with diabetes mellitus had diabetes foot ulcer. Diabetes foot ulcer is mainly caused by ischemic neuropathic or convenient neuroskin abnormalities. The healing of ulcer in patients with diabetes is reported to be poor. It is reported that a considerable number of the patients with diabetes foot ulcer remain unhealed after 12 weeks of treatment. An interval case healing occurs in 2 or 5 months virtually. Prevent the most serious complication of this problem. The primary management goals of diabetes foot ulcer are obtained one closer as expeditious as possible. As diabetes is a multi-organ systemic disease, all comorbidities that affect one healing must be managed by a multidisciplinary team for optimal outcomes with diabetes foot ulcer. Today, various herbal products have been used in the management and treatment of diabetes foot ulcer. Some studies have shown that herbal products provide accelerated healing and decrease the rate of recurrent ulcer complication in the patient with diabetes. One of other herbal extracts that is used as external administration in healing of diverse foot ulcer has been reported in previous studies is olive oil. In two case reported studies, in Iran, the administration of propolis and olive oil extract and application of honey and olive oil mixture report to be effective in healing of diabetes foot ulcer. Also, in two quasi experiments, studies that were conducted in Egypt, results shows the effectiveness of Australian olive oil ointment. Dressing testing of the healing of diabetes foot ulcer. Therefore, due to conflicting results of the research that have assessed the effect of olive oil on the healing of diabetes foot ulcer and so that most funded studies in the records are case report and quasi experimental indexing, and also recording to the important role of diabetes foot ulcer management. The present study Edmond assessed the effect of tropical olive oil on the healing of diabetes foot ulcer as a clinical trial study to find a novel approach in treatment of this kind of ulcer.
Hello guys, I'm teacher. Mirror this double-blind research clinical trial study was conducted in diabetes clinic of Alvarez Collection Hospital Iran in 2000 and forgotten 34 parents with of Warner used grade 1 or 2 were enrolled in this study. Parents who were randomly assigned to intervention group. 17 received topical olive oil in addition to routine carriers, while parents in control group. 17 just received routine carriers. Intervention was done using a day for 4 weeks in both groups, and in the end of each week, the users were assigned a score that was collect the demographic and clinical characteristics, checklist as well as diabetic, food ulcer, healing checklist, and was analyzed the version 99 software using script, mean and standard deviation and analytic. Student sample test check.
The study was conducted in patients with the disease of diabetes for which a ulcer had been created somewhere in their body, and the fourth time was a point in the which it was wanted to deformate its effectiveness. Result: demographic and basal characteristics of the 24 patients enrolled in the study aren't to the protocol. Therefore, 30 patients, 15 patients in the intervention group and 15 patients in control group were incorporated at final analysis. In the study, just one patient and in the control and one patient intervention group received offloading with choice modified. The patient age in both study groups was ranged from 14 and 65 years from intervention and control group respectively. Adverse effect: all patients tolerate treatment by topical olive very well, and there were no adverse effects to report during the study. Discussion: DFU is a common specific and debilitating problem among diabetic patients that may involve infection and amputation. Therefore, today several different methods have been studied to achieve better results in the treatment of this sort of ulcer. Finally, this study is limited by virtue of a small patient population that may create a low power of stative analysis. So is it somewhere that future study pay more attention to the limits and conduct the investigation with our kinds of olive oil and treat and follow of patients until complete healing. Conclusion: our results indicate that olive oil in combination with routine create is more effective than rolling care alone, and this which don't any side effect. However, future studies are required in the future to confirm this result.